And I'm with Dr. Eddie Fernandez right now. We are at the Center for Vein Restoration. Let's talk about some of the important services that you provide here for the community.
Yes, absolutely. So we are the largest provider of venous vascular care. And our primary emphasis is that it's taking care of patients with vein disease of their lower extremity primarily, patients who have had a history of DVTs, as well as what we call venous insufficiency or venous hypertension.
How much does vascular disease affect the general population?
It's incredible when it comes to venous vascular disease. It is the most common vascular disorder worldwide. In the United States, we're talking 30 to 40 million people. 10 to 20% of males affected with this condition, and 20 to 40% of females affected with this condition.
Let's talk about how you treat varicose and spider veins. I know this is pretty common in a lot of people.
Yes, those are some of the early signs associated with venous insufficiency. Spider veins easily treatable with what we call sclerotherapy, injection of a solution that irritates those vessels. Varicose veins are representative that there is likely a bigger problem, and we need to then use an ultrasound to look further into the leg and see where they are originating from, so we can treat the source. Once you treat the source, you can treat the varicose veins, again, through sclerotherapy or something we call microphlebectomy, to really eliminate that diseased vein. And this is the key. This is a diseased vein. This is a disease like any other. It's not a cosmetic condition. It has a cosmetic effect, but it has a medical problem behind it.
Let's talk about that cosmetic effect. We've seen some before and after pictures. With treatment, you can actually change some things.
Oh, absolutely. And patients do great. And the idea is to address this at that earliest stage, preferably at the varicose stage, because as the disease progresses, it does lead to chronic swelling, something that we call fleval lymphedema. It does lead to permanent hyperpigmentation, and unfortunately, some patients will develop ulcerations or breakdown of the skin.
If people have been putting off visits to the clinic because of COVID-19, your clinics have stayed open during the entire pandemic.
We felt very important that we were here to provide a service to the community, and we made that decision from March 16th, when everything locked down, to remain open. And we're very happy to that all our precautions have worked. Our staff has stayed safe. Our patients have stayed safe, which is just as important. And during those lockdown times, we were one of the few vascular clinics that were available to provide care to these patients. So we're proud of that. We did it through the lockdown, and we're here for our community ongoing.
If people watching right now are in pain, if they're standing in front of the mirror and not liking the way they look, if they're dreading putting that swimsuit on this coming summer and spring, what's your advice to them, and how do they get a hold of you?
Yes, thank you so much. So it's very important to recognize the symptoms as well as the signs. So yes, it's very important that patients can have pain, nighttime cramping with venous insufficiency, as well as the manifestations of the skin that we have discussed. And as we all want to come out of this pandemic, they can call 1-800-FIX-LEGS or call our centers. I believe you're putting the phone number on the screen, and we will be available to help them.
Center for Vein Restoration, Dr. Eddie Fernandez, thank you so much for your time today.
Thank you so much for having me.